It's a lot of vaccine, and of course it's made more complicated by the fact that we still need a seasonal flu vaccine, and that the same companies that are producing the H1N1 vaccine produce the seasonal flu vaccine, and we didn't want to have one substitute for the other. So the federal government arranged to identify a number of companies who had the capacity to develop a vaccine for H1N1 with very little time to do so, since we only discovered this vaccine in the spring of this year. They quickly were able to do the research, they quickly were able to identify a very safe vaccine, and then they were able to have the companies that previously worked on seasonal flu vaccine begin to produce this particular vaccine in record numbers. And even though it has become available to us in smaller quantities than we hoped, a little bit slower than we hoped, it is a remarkable achievement that we have both vaccines, and within a relatively short amount of time, in a few months, we will have enough H1N1 vaccine for anyone in the country who would like to be vaccinated.
And I think, just to pick up on what the Commissioner said, that this vaccine for H1N1 is made by the same companies through the same process in the same manner that they've made seasonal flu vaccine, which has an extremely safe track record, and we've been using it for decades with very good outcomes. I think that if we had discovered, or if the outbreak from H1N1 had come a little bit earlier than the end of April, it's quite likely that it would have been included in this year's seasonal flu vaccine, so we would only have one vaccine to give. Unfortunately, it came when it did, so we have to make do this year.
This has been an interesting year because there have been people who do have concerns about vaccines, and so it is important we speak to that issue. But it's also been a time where there have been many more people who wanted to be vaccinated that could be vaccinated in a short amount of time, because the vaccine didn't come as quickly as we hoped it would. And so we know many people have tried to find someone who had the vaccine, either their physician or a clinic in their community where they could be vaccinated. And we are hoping that people continue to be patient about the time it takes to have sufficient vaccine. And if they hadn't been successful initially, they don't give up, but they wait a week or so, call their clinician again, or call their local health department and just check in, is the vaccine available? We're confident that in the coming weeks it will be more and more accessible to the public.
And I think that's a good thing to point out, is that no matter when the vaccine becomes available, it's worth it and very important to get it. We don't want people to get a sense that, well, I haven't gotten it by this time, I shouldn't even bother. No matter when it becomes available, people should get it. We expect this flu season to be the regular length, which is long. I mean, we have flu through April, so.
I'm just thinking, I have patients that come in, well, I've never gotten the flu. Why should I get the flu shot? I don't really have a logical answer for that, other than to say that's illogical to think because you haven't gotten it that you can't get it. So there is no time that's too late.
Yes, and I think that the risk categories have changed. So many of my patients give me that same exact argument, but most of my patients who are pregnant are young and healthy and have not been in the indicated risk group to get the vaccine. But once they're pregnant, all of a sudden they're considered high risk for untoward effects if they do get sick. So I think that I've never had it before is not a reason not to get it.
I'd also add that one reason I think it's important for people to think about getting vaccinated for the seasonal flu vaccine, even if they've never done it before, and H1N1 this year, has to do with our larger responsibility as citizens. We at the Department of Public Health are very concerned about having a well-functioning healthcare system. We don't want our emergency rooms overcrowded. We don't want hospital beds too filled so that if people have emergencies, they can't easily get into a medical facility. And so one way of controlling illness is reducing the number of people who will get either kind of influenza this year. And so even if they're maybe convinced that they're not so much at risk based on their own experience, it's really worth doing it as part of a civic responsibility to think about the larger